everyone to another episode of Letstalkfurreal. So today we still have Dr. Ng with us, and we'll be talking more about are pet parents listening to Google, friends, social media, everyone more than their own vets. So hi Dr. Ng, welcome back. So do you face issues with pet parents asking Google or other sources of social media or friends, etc.?
I don't really think it's a problem. Vets ourselves also source for information online. I think it's just really sourcing for credible information and accurate information, and that helps because it helps to formulate a plan, for example, or come up with a differential diagnosis, things like that, and be able to accurately diagnose what's going on with the pets. Yep. And quite often pet owners would come in and say, "Oh, I think my cat has this," and then sometimes we'll tell them otherwise, and then sometimes they're correct, but it's not always the case.
And do you have cases where they end up listening to their external source rather than listening to you?
Of course, I may not be right all the time, and in fact, one of the most important things with medicine is that you should always seek a second opinion or even a third opinion if you are ever in doubt. Just like human, if one day my doctor was to tell me that I think you have cancer, and then I would seek a second opinion as well. It's a normal human nature.
So, but does it happen often that pet parents will be like, "Oh no"?
Yeah, I think not really. I don't think it really happens that often. So, like I said, most days, I will have pet owners that will come in and say, "I think my pet has this." But usually they're quite okay if I tell them that I think it's something else, or even if it's the same thing. Usually they're quite okay.
And are there a certain demographic of people who are more likely to do that?
I think possibly firstly maybe the younger generations. They have access to internet all the time. They know how to source for information. And they know where to look for accurate information and things like that. So usually they will come in and tell me, after doing some research, it looks like it's this and things like that. Yeah. I guess the other group of people that often quite would listen to their friends a lot more. The older generations actually, and because when they bring their dog down for a walk maybe, and then they meet their doggy friends and fellow owners, and sometimes they may talk about certain things, and I think one of the most common thing I hear from pet owners is that my dog is allergic to chicken. And I think a lot of people in the audience would also agree. My dog is allergic to chicken. But I always give this example. If you have 90% of the people in the population giving chicken as a source of protein, which is true because a lot of people would give chicken as a source of protein because it's cheap, it's easily available, it's easy to cook and things like that. Then you would have a higher percentage of people that will say that my pet is allergic to chicken. It's like saying a higher population of Singapore population is Chinese. You know what I'm trying to say? Yeah, and so I think don't believe in false information. A lot of people having pets that are allergic to chicken doesn't mean that your pet is allergic to chicken.
Yeah, we also understand that there's like tests available to test whether your pets are allergic to a certain thing. And how often do you really test out that pets are actually really allergic to chicken?
Not often. I think it really depends on which context we're talking about. For example, if the pet presents for skin condition and we're suspicious that maybe the pet has a food related allergy and that's causing skin conditions, Then usually what we would do, or as a gold standard, what we do is we do a food trial with hypoallergenic trial, hydrolyzed protein to trial and see whether or not the pet is truly allergic to certain types of protein. And it's a very common misconception that pet food trials are actually are used as a treatment, but it's actually more of a diagnostic tool. It's used over a period of 8 weeks to see whether or not the pet is actually allergic to any of the proteins that the pet was previously taking. Yeah.
Okay. Interesting. So let's move on a bit more to the rise of self-diagnosis. So we know the impact of the internet is on all of us, right? And how has the increasing accessibility of information on the internet, particularly like social media, influenced pet parents' decision regarding their pet's health?
I think the most dangerous thing with that is when they decide to delay treatment or not bring their pet for a vet consultation. I think that's that can quite often cause conditions to become quite bad and may even become irreversible. Yeah.
Yeah, we know that if like you mentioned about the delay of treatment has an issue, but I believe there are also some positives to like social media or the accessibility to internet. So maybe you could tell us a bit more on that.
Yeah, for sure. I think if your pet has a condition or showing some clinical signs, for example, a difficulty in urinating or things like that. If your cat is having difficulty in urinating, and usually the first thing people would do is source on the internet and see what could be potentially wrong with their cat, and then they may find that possibilities would include things like a urinary tract infection, a kidney infection, or a urinary blockage, which is actually an emergency. And we want to see these cats within 24 to 48 hours because if they are not able to urinate, and then of course the end result is that the bladder could potentially rupture and of course cost the cat's life. And if owners read information like that and then generally people would be really worried and then seek medical help immediately.
Are there any particular like places that would be more reliable sources, like particular websites and all that? How do pet parents identify that?
Yeah, I think looking into the literature paper and things like that would be really quite difficult for owners to understand sometimes because the use of certain medical terms which most of the general public may not understand. So Google itself does come with certain websites that's been started by medical professionals or vets themselves, and those are the websites that potentially they can look at and look for matching clinical signs, and then decide whether or not to seek medical attention for their pets. But actually, your vet clinics are just one call away, so call your vet clinics, call your vets and see whether or not we feel that it's important for them to bring their pets down for a checkup.
Yeah, so I think this is great information for pet parents as well. Like, if you see that your pet is maybe acting not quite right, or you see anything you're a bit concerned about, then just give your vet clinics a call first. That would.
Yeah. We see your pet sometimes once or twice a year, 3 times a year, but you spend most of the time with your pets around. Your pet's character, how they're normally like. So any changes may point towards certain conditions, and which will always be better if treated earlier.
Derrick, anything to add?
From the vet point of view, is there a recommendation for owners to bring their pets down for a yearly checkup per year?
Yeah, I think it's one of those things that a lot of people don't see that it's important. It's really important, especially for geriatric patients. If you have a dog or cat that's above 6 or 7 years of age, that's almost equivalent to almost a 50-year-old human. And with us, we do our yearly checkups, or some of us even do half a year checkup. things like that. So your pet needs that as well. And it's of course to pick up early detection of early disease, and it does help with management and also the prognosis of your pet condition as well.
This podcast is proudly sponsored by Hill's Prescription Diet. Does your pet experience food sensitivities and fat sensitivities? ZD Low Fat is specially formulated with hydrolyzed soy protein and low fat levels to help avoid adverse food reactions and promote healthy skin in dogs with food and fat sensitivities. The Active Biome Plus ingredient technology is clinically shown to rapidly activate the gut microbiome to support digestive health and well-being. Enjoy the benefits of healthy gut and healthy skin for dogs with food and fat sensitivities with Hill's Prescription Diet ZD Low Fat. Yes, that's all that benefit in one food. Visit your vet to learn more about how it can improve your pet's well-being.
Yep.
And just now you also mentioned about second opinions, right?
Yes.
So would the second opinion be like to another vet clinic, or what kind of second opinions? Some people think second opinion is Googling, right? So
No, hopefully not Google. Hopefully it will be another vet professional. And I always think that's really important because if the same thing happened to me or any of my close ones, I would be quite concerned, and I would always be interested to see what another medical professional would say. And based on the reports or reports or any diagnostics that's been performed already, and then to see whether or not, because sometimes another vet may also have another opinion or maybe another treatment option, which may be a bit more comfortable for you or for your pet.
Okay. So other than the internet, we also understand that many people, I mean, even myself, we trust our friends, our families especially a lot, right? So, but however, have you seen any of like, this has been one of the causes for misinformation? Like, maybe a family member say, no need treatment, one eye is fine. And then...
of course. I think it's not. I think the no need treatment one, it's maybe I'm not hearing it as much, or maybe I'm not hearing it in the clinic. But a lot of people would have treatment of their own, or friends have tried this and it worked, and then so they want to try the same thing before coming to the vet. And then, or quite often, what it will almost always cause is that it causes delay in treatment and proper management of the pets. I've had clients that would feed, for example, the dog ate something, and something that could potentially be obstructive, or something like chocolate, and a lot of people would try giving salt to the dog. And the reason is because on Google it says salt is one of the potential use of salt is to induce vomiting, and so a lot of people will try feeding salt. But what they don't recognize is that when you give salt, it can end up causing more electrolyte imbalances, causes the patient to get dehydrated, and actually it's not a reliable way of treatment.
So you have seen, like, has someone brought to your clinic and like, I fed salt
to
induce vomiting?
Yes.
Oh dear. And did that cause more complications?
Of course the vomiting didn't happen, but the pet ended up being hospitalized because of imbalances in electrolytes, and further treatment is required, and of course then adding up to the cost.
Okay.
Salt.
Okay. And so that's one of the dangers of self-diagnosing, which is like the delay and also using the wrong method
of treatment.
Yeah. So would you advise pet parents, if they see any issues with their pets, don't try those methods on Google first? Call your clinics first.
Yeah, I think you can always call in. I think a lot of us are more than happy to speak to owners, and if we're not able to see them as an emergency or immediately, most of the time we will still be able to provide some kind of useful information. The other thing that quite commonly get is, my pet dog is squinting in the eye, but I can't bring my dog in. What can I do? Things like that. So what we will always advise is that if you have contact lens solution or normal saline solution at home, or if you can't, if you don't have, then it's easily you can easily get them from pharmacy, and then do a flush of the eye to see whether or not it gets better. If you have an e-collar at home, one of those cone of shame at home, and then you can always put it on first to prevent further damaging of the eye, things like that. Yeah, so those are all quite useful information which you may not be able to find on Google. And then whenever you're available, then bring your pet in, and then we can have a check and see.
Okay, yeah, that's good to know. Yeah, always check with your vet clinics first. Yeah. So nowadays we hear that there are some mistrust going on between vets and clients sometimes. So why do you think there seems to be this mistrust going on at times?
I think it happens because if you bring for example, if you bring your very chubby, happy dog in and to a vet, and then the vet says, I think your dog actually has hormonal issue, then you may think that the vet is not, the vet is just saying something so that the vet can get you to do some diagnostics or, run certain tests and then to bring up the bill, etc. But actually there's some truth in what the vet is saying, because if you have an abnormally chubby dog, then the dog may well have underlying hormonal issue. So for example, hypothyroidism or Cushing's disease may make the dog abnormally chubby. And if, for example, you're just bringing the dog in for a skin check or a vaccination, and then the vet brings that up to you, you may think otherwise. And then, only on further questioning or further sort of investigation will we know that whether or not your dog truly has got some kind of other underlying condition.
Mm-hmm. So it's interesting that you brought up chubby dogs, right? Because from what we understand is that if you tell the pet owners that their chubby pets are overweight, it's a bit harder to convince compared to like a overweight human. Because a lot of times when we see our pets, they're chubby, we're like, so cute, nothing wrong, right?
Yeah. I agree. I think certain breeds just need to be a bit chubbier in order for them to look a bit cuter. Yeah.
Yeah, like your brachycephalic breeds, right?
No, they shouldn't be chubby. Yeah, no, they shouldn't be obese. Yeah, but I think Dachshunds should look a bit chubby. Yeah. Or corgis.
Oh, yes.
Yes.
Yeah, corgis.
Yeah.
And their butts very cute when they're chubby.
But these two breeds that you're bringing out, aren't chubby, will cause a lot
No,
of
chubby
issues.
is never good. Yeah, but
it's never good. It's just that they look cuter, but it's never good, right?
Yeah, I guess what I'm trying to say in relation to the previous point is that, for example, if you don't even recognize that your dog being overweight or chubby is a problem, then sometimes it may mean that actually your dog has some underlying condition, and it should always be treated earlier, and you should appreciate that the vet is telling you that.
Yeah. Okay. So regarding, I agree that building that relationship with the pets can really help the pet parents feel that, the team really cares for my pets. Yeah, because I think one thing that pet parents also really we should understand is that a lot of vets and a lot of vet nurses, they are in this industry because of their genuine love for pets, right? Because it's actually not a very easy road, especially for vets, right? You have to go overseas, like we mentioned just now. The fees are not cheap as well. Yeah. Yeah,
I don't think anybody would get into this without firstly the love for animals. And I would strongly disagree if, as I said, we are just in this for money, as one of the most common thing that's being said nowadays. It's not as straightforward as that. Of course, you have to have the love for certain things before you can even do some things for such a long time. I always tell my wife that we have the best job in the world because we get to do what we genuinely love. Yeah. And you know, I think to a lot of people, a lot of general public, even my parents, they think that I go to my clinic just to play with dogs and cats. Yes, but it's not the case. We actually do quite a lot of extensive workups, surgery, diagnostics, treatment, things like that. Yeah.
Derrick, anything to add? Okay, so yeah, thank you so much, Dr. Ng. I think we had a very good insight into how the vet clinic works, and you know, the previous episode on why the bills are the way they are. And also in this episode, that is very important to really not self-diagnose first. Call your clinics. The clinics are happy to answer. Yeah, and then take it from there. So anything else to add, Dr. Ng?
Nothing.
All right, great. Thank you so much, Dr. Ng. We'll see you in the next episode.